Okay, it is 12:04. We're going to go ahead and get the CJCC meeting started for November 13th. Can we do roll call?
Monica Isham, Julia Lyons,
Here.
Grant Gerber, Andy Alvarado, Mike Wohler,
Here.
Tweed Schuman, Doug Morotek,
Here.
Bruce Poquette, Katie Berlanger, John Yackel, Mark Helwig, Elaine Smith, Marshall Savitsky, Kathy McCoy, Bill Trepanier. You have a quorum.
Okay, certification with compliance with open meetings law.
Let the record show this meeting was noticed to the public and the news media as required by section 19.84 of the Wisconsin statutes.
And we'll go back and do the Pledge of Allegiance that I first skipped. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I know, I better be checking each section that I get it done here. Review of the meeting agenda. Is there any changes to be made? Okay, hearing none. Public comments. Seeing no public comments, we'll go on to consideration of the approval of minutes from the previous meeting.
Make a motion to approve. Second.
Any discussion? All in favor? Passed. Okay. Jail report.
Thank you. The October 24 jail report, we've seen an average daily population of 50 inmates, 14 and a half females to 35 and a half males. Average probation incarceration were at 14, pre-sentence incarceration at 27.25, and sentence inmates at 8.75. We currently had 4 on electronic monitoring. The day that this report was generated, we had 50 inmates with a unemployment rate of 71%.
Any questions? Did you have anything on the law library or mental health counseling update? I see that's on there. Okay. Did we need to keep that on there, or does that can that just come off? Is that like was left over maybe from the last meeting?
I think it's already been addressed.
Okay. Okay, then moving on to criminal justice coordinator, TAD grant update. And I think Andy, do you have, okay, we'll let him get up and running here.
So Becky is traveling today and is unable to attend the meeting, so she did send me a report. Let me just see if I can get. I will just read it. The 2025 TAD grant application has been submitted, and we were asked to make edits in 2 areas, one with the budget and one in the treatment court goals and objectives section. Edits were completed and submitted last week, but surprise, we got an email this morning with more requests for information. So that is still being worked on. I'm sure she'll get that submitted. Building bridges has begun, and we had our first meeting on October 30th. Reaching rule is in an implementation period. The grant application was submitted on October 15th, with the final presentation taking place in February in Washington, D.C. Pre-trial, they have begun taking people off the wait list and will continue doing so. Treatment court, Becky would like to recognize all the efforts of everyone that works together, whether it be Justice Point staff, law enforcement, court staff, DA's office, public defender's office, public health, probation, parole, AODA, mental health, and everyone that works together, but also particularly with recovery court, because it takes a significant amount of time in addition to people's regular workload to commit to recovery court. And we have a very supportive group that has been dedicated from the beginning to make it work. It's not easy. There are a lot of different ideas, personalities, experience, and sometimes things get difficult, not to mention the juggling of time management. She wants to make sure everyone knows that their time and effort is making a difference. And she can guarantee that to someone the time spent is worth it. Justice Point is hiring 4 new positions. This are 3 peer systems navigators, 1 coordinated response specialist, and 1 pretrial diversion case manager. And they're trying to have them filled by January 1st if possible. Jail programs, they now have a process in place for jail residents to sign a release to be photographed when they complete their GED, HSED, and will share that information if they wish. They are having a holiday card creation event scheduled for December 7th for residents to make a card to send to a loved one. Also on the 7th, Justice Point is hosting an appreciation day for professional visitors, volunteers in the Justice Point office to include snacks and beverages. And then the statistics, I'll put those up on the screen. So this is the active clients for pretrial, diversion, and treatment court. So it looks like we have 153 active in pretrial, 11 in diversion, and 8 in treatment court. 1 person successfully through diversion, and then 12 referrals for pretrial and 7 for diversion. Program type by race. Gender by program type. Case type by program. That's that. If you have any questions, email Becky.
Okay, Alex, can you put up the Health and Human Services report that's in there? And Joyce, do you want to come up and speak to that?
I'm going to be very quick because I'm going to introduce our, whoops. My report, because I'm going to introduce our peer recovery team so that they can talk to you quickly about the program that they've put together and what they've been up to. But I will just let you know the Narcan continues to come off the shelves. It's being used pretty regularly, especially at the winter Nalox box that we have down there in the grocery store. So we are replacing that quite frequently. We are working on new billboard designs for overdose, and the vaping campaign, we have set a time period. So we will be presenting about vaping to the schools in March of next year. We did provide Narcan to the election offices throughout the county before Election Day. And the flyers that you're seeing are the flyers, they're the new flyers that we've given to the inmate tablets. So the inmates can see those while they are there and before they get out. So having said that, come on up, Ken. So we have Brittany on Zoom, and this is Ken. And I'm going to let them introduce themselves to you. And then they did give you some information in the report, and I'll let you have it.
Alex, can you get it so Brittany's on the screen? Yep, she's up. We're ready to go.
Well, thank you guys for letting me be here. So last year we started doing the peer recovery and recovery coaching for here in Sawyer County. And over that time span, we've had close to 30 people that, as far as like referrals that we got from self referrals and agency referrals. And the reports here, 11 of those, they were jail inmates, so it's kind of hard to actually start working with them because it is a voluntary program. And what I've kind of noticed is, while we're working with them while they're in custody, is that they're more than willing to do, whatever it takes. And then once they get out, it's completely voluntary, and it's a little bit more of a struggle where they get other ideas when they get out there. But of the ones that we have worked with that have kept coming back, I was able to get 12 of them as clients. And of those 12, I was able to close out 5 of them where they were, confident in their ability to maintain their recovery and maintain their sobriety. And the other ones, they either lost interest, or they returned to substance use, or they just went another route because it is a voluntary program. For each of those that we work with, there is no cookie cutter, method of recovery for them, where it's not gonna, what's worked for one isn't gonna work for all of them. So kind of what we do is we see what their needs are, and we kind of help with, accommodate with those and see what we can do as far as helping them with them. And some of them, it's simple as helping them find employment. Others is finding what they need to do to get their driver's license so that they can, quit driving without a license, and it makes it easier to go to work and go to appointments and get on to the next step. And just exploring the different pathways of recovery with them, because there's, like I said, there's no cookie cutter response to it, where what worked for me isn't going to work for everybody, and vice versa. So kind of in a nutshell, that's what we do, is just kind of go case by case and see what the needs are of people and see what we can do to help them.
I just want to mention that he's being very humble. The first probably 8 months of this program was just Ken getting all of this set up. So these 12 and these 5 that have graduated have been in the last, in a 6-month period of time of him working with them. So I think that says a lot for what he's doing. And now we have Brittany, who has come on board. Ken has been on WRLS a few times. And, one of the things he mentions is, Brittany is a mother, and he can't relate to people on the mother side of it, but Brittany can. So we're trying to cover all the bases, but he's doing it's really a super job. So, and we will give you these numbers probably every quarter just to keep you guys updated. Anything else?
Oh, Brittany, you got anything to add?
Not really, besides I'm Brittany. I'm new this year, and I am very excited to work with Joyce and Ken. They do amazing things, and I'm excited to see where it goes this year for me.
Thank you. We're very excited to have you guys.
Thank you.
So both of these two are working through AmeriCorps. I don't know if we clearly said that for the peer recovery. Kenneth is on his 2nd year. Brittany, you had already put a year in with Marshfield. You're on a 2nd year, correct? Yep.
Yes.
So she's transitioning over to us. So we're very excited to get her on board. And so that we used COVID ARPA last year. You'll remember I said I used braiding and blending in order to be able to kind of not use opioid dollars as much. Going into the next year, we've designated, and that's part of what I'm going to show you today, is how we want to perhaps use our opioid funds. So does anybody have any questions related to this section before I move on in the agenda?
I think I have a question.
I don't know if I can answer it, but
I
Joyce
don't
is
know.
here.
Maybe just explain, just, how does somebody get to the peer counselors? What's the intake.
the avenue to
referral.
that? Do you guys want to talk about the avenue to get through, and
Like,
what our
are
referral
there
looks like?
referrals, or how does the public know that
Mhm.
this is?
There are referrals. It's really, so far it's been Ken putting the word out, just around the community and talking to people that he knows. But we've also received referrals. The hospital has a referral form that they can send to us. And then we're also working on a jail program so that we can get into the jails a little bit more. That's really where we'd like our focus to be, to start with those jails.
And then the billboard signs that are out
Yes.
does lead them to the peer support specialists on our website.
Yeah, I've been interviewing at the jail for now about almost a year, trying to get enough people for some research we're doing. And when I ask them, how do we reach you? How do I get a message to you? They always say those bleeping billboards and road signs. So we know that they're seeing them. And we know, and they've actually come into even Justice Point. One of the people on that billboard is a caseworker for Justice Point. And we'll be like, oh, I saw you on the billboard. So we know that that stuff's working.
Good question. Anything else? Okay, then I'm gonna go into, we still haven't heard anything further on our additional grant application that we had made for YJ. But we do have the truancy grant and another grant that's come through, so that we're working on filling. Well, we can't fill staffing for truancy until January, but the other one we're working with our contracted service on to be able to fill that position, which is really more in-home treatment services that we're able to do with the families. And then opioid settlement funds, to give you a look at this. Hopefully everybody can see the screen, and I tried to make everything big enough here. So between August 2023 and October 2024, we had presented a budget of $127,650. In 2023, we spent $17,300, and in 2024, we're projected to spend close to $30,000. So of the 127,000 budgeted, we're spending close to 50. And again, that's due to being able to use other funds to be able to meet these needs. So this year, we're under budget by 80,000. We put together, not me, Joyce put together all of the different things that we've done with overall for opioid work. And I'll just kind of quickly go through some of these. They've provided education and collaboration between law enforcement and treatment providers on the legality of fentanyl test strips and naloxone. That was really early on, almost forgot about that. We've acquired Narcan distributor grant and distributed over 1,100 boxes. And I can say that we did just get the additional grant coming through. Is that going to be I can't even remember how many, it's 90 cases. Yeah, and so anyways, we got a pretty good chunk of naloxone coming that we're able to distribute. We did evaluate the need for supervised injection sites. That's one of the harm reduction things. And we looked at overdoses, and most of them are occurring in home and not in public places. So we determined there's no need for that. Evaluated a need for clean needle exchange, and based on interviews with inmates, it was determined that this would create a usage island, enticing others into our communities. So we are not doing that. Provided fentanyl drug overdose training in the schools and students. And so we served over 3,500 people with that, and did researching on vaping options, working with the school presentation and marketing, and that's going to be coming up. Worked with YJ clients for vaping survey and input, interviewed over 60 inmates. I'm not even, you might be a little over that now. Joyce will continue until she reaches 100. Researched opioid, I have a typo there, prescribing guideline changes, and ensure that providers are aware of those changes in the current guidelines. Connected with hospitals and clinics regarding refusal to participate in drug prescribing incentives. So that's really those when they give you gifts and things for prescribing certain drugs, so they do not do that. Participated and promoted in drug take-back twice per year. We've collected 217 pounds of controlled substances, 65 of non-controlled, 80 pounds of sharps in 2023. Collaborated with the Prevention Use Coalition, conducted community overdose education and treatment and service providers at Seven Winds. We had 171 residents attend that. The peer counseling program, which you guys just heard about, created flyers highlighting services available for substance use, and over 700 flyers have been handed out at different events. Have collaborated with Namakongan Transit to make sure bus service goes to treatment providers. Collaborated with the hospital to provide a 3-day supply of Suboxone and a warm handoff to treatment services. Provided MAT training for law enforcement and first responders, and participated in Recovery Court Steering Committee. So quite a few things and more things to come. So as we kind of pull things together, obviously all of this wasn't done with opioid settlement dollars. It's all a big package, and multiple programs are working on different things. So we'll try to package it up as a whole package of what all we're doing as a community. But for this now, we're going to focus on what we're getting in for opioid funds and where we want those funds to go. So how the opioid settlement funds work is that they come in over time. So we kind of talked about that a little bit before, but we didn't really have a good spreadsheet set up to kind of show how funds were coming in. We get it from the distributors, from pharmacies, and from the makers of it, so Janssen. So this is kind of the estimates over time as they come in, just so that you can kind of see how it's coming. You don't have to memorize these dollars, but you can see we've got funds coming in through 2038. As you can see, though, those funds drop off considerably over the years. So how do we work with these funds in order to make the best use of them over time? What I propose doing is looking at being able to pick a budgeted amount that we want to spend each year, focusing a higher amount of dollars in the first 5 years, and then start to taper off as we get some things under our belt. So we'll have to see if you guys agree with this or not, but kind of played around to see what was that max amount I could get in that budget. So starting out, we have a beginning balance right now going into 2025 of $296,000. So if we spend $100,000 in 2025, 2026, 2027, 2028, and 2029, that still leaves us with enough to be able to start kind of keeping money coming in, but spending down. So, and we like drop down to 80,000, to 75,000, 70,000, until we get down to the end where we'll only have about 29,000 to spend, or 27,000 to spend in 2039. So that's kind of how I propose putting a budget together, as far as how much we could spend each year. And then if we look at that, oops, I got my slides a little mixed up. If we look at that, then we take that 100,000 and say, okay, what do we need to spend money on using exhibits, the Exhibit E? And what we did before was we looked at harm reduction, prevention, treatment, and recovery. Those are all things that are covered in Exhibit E from different levels. So recommendation would be that we look at spending $1,500 on drug take-back promotional materials. It's something that we work with law enforcement on, and I think it's a really successful program. But if we can market that even better and get that out. The other thing is we're also try to make sure that we do it so that we have availability to drop off in the southern part of the county as well. Prevention, looking at kind of the same kind of campaigns that we've had. We know that those are successful, getting into the schools. Vaping has been a big issue that we've heard on for a while now. We wanted to do it in the fall. It just didn't work out with the schools to be able to do that. So being able to plan that and get that managed for the spring, looking at 16,500. I have an area that's marked here in highlighted yellow as one area that we could potentially spend some funding in, depending on, and I know we got the Building Bridges grant and some different things. I don't know what that funding really is looking like for MAT in the jail, so we might need to assess that. Medication assisted therapy. So it's like the, yeah, it's here. If you want to know, a good point. So looking at that, potentially helping with therapy in that area. Whoops. And then in recovery, we've got our recovery coaches. So we only have to pay a small portion of what they get paid because AmeriCorps covers the other. Looking at sober activity and events for youth and adults. So those, people who are trying to be in recovery, there are no good places for them to gather and connect in. And being able to offer some types of events or get-togethers is a recommended activity to do. Another recommendation, and this is the one that's in yellow here, is providing support for family members suffering with trauma due to addiction. And that refers to, I have that over on the blue part, where it refers to assisting families who are dealing with addiction to get them wraparound services such as parenting classes, paying for childcare, helping provide supportive housing, or any services related to children being removed from their homes due to opioid use disorder. This was a recommendation that came through from one of our board members who had seen this from actually a district supervisor. Geez, I can't even talk today. Having seen them use these funding in other counties related to children who are removed from homes and helping to assist grandparents and those that are trying to help take care of these kids. And then the other pieces, the marketing and communication services that we received through Finden, they help us do all of these flyers and multiple Facebook posts and tons of different communication services that we just couldn't get done on our own. And then for public health staffing, paying for an average of 8 hours a week for prevention planning, data collection, grant writing, overdose fatality reviews, peer recovery oversight, and the recovery sober planning services. So Joyce and Jess spend way more than that on there, but being able to keep them moving forward in that direction. So that kind of sums up where the recommendations would be for spending funding, but what I didn't know is where this group would want to focus. Do we look at the MAT in the jail? We have about 22,500 left. And do we do that? Do we split it and put some towards MAT and some towards helping families? Does anybody have any thoughts on anything else? I'll pull this back up for you.
I have a question.
Mm-hmm.
How are we getting the Suboxone to individuals?
The Suboxone for MAT, so that comes directly at this point, are you talking through jail or in the general public? General public would go either through North Lakes or through Beziki. And they have a treatment provider, they have treatment services, and then they receive MAT as part of their treatment. So they go directly to that source to get that treatment. In the jail, we work with the LCO pharmacy
at this point to get MAT because we're able to provide some, but we're not able to induce or have an induction, meaning you can't put, if they haven't already been on it, we can't start it. And that's what we're going through all the training and doing the grant for.
So if they didn't come in the jail already on Suboxone, there's nothing that
At
can,
this point, we don't have a program set up that we can do that, but we are moving in that direction. I just don't know how much that grant is covering as we move forward.
thank you.
Other thoughts on spending? Oh,
I
yeah.
just have a question. So, what about mental health counseling
So we have for the jail or in general?
in general?
In general, so we have a change coming. I don't know if everybody has heard, but Joe Bodo has put in his retirement. So right now we're reassessing where we're at. We do have in our budget to hire a counselor or a therapist. And then we have Joe's position, which had therapy attached to it as well. So we're in the process of redetermining that. So we do have, that is funded through the budget already.
Okay. And as far as the jail goes, are we providing enough hours at this point?
At this point with our inmate population as low as this, yeah, I would say we are.
Okay.
My only concern is that we don't have a provider who is trained in SUD. So that would be something that we would be looking at and perhaps be able to connect to some of the staffing that we'd be looking at. And again, as we develop through building bridges, what that plan looks like and how we move forward will help drive that. So we'll keep bringing that. And we have a training coming up in January.
Good. Thank you.
Mhm.
You mentioned that the counselor is in the budget. I mean, do we have one or do you have a?
For the HHS budget, we have positions approved, so to move forward. Your light was on. I was just looking
Yeah,
to
no,
see if you had a comment yet.
Oh, I thought you saw the light on my head. I was thinking about, I mean, I think to both your questions with, well, last year we made a change with mental health counseling in the jail that I think was positive, where we brought that in direct rather than working through the medical provider. But, you know, that's always going to be up for assessing how it ties in. Let me go back maybe. I think we've had some separation there. I don't know when that started, but our county staff has not been providing mental health services in the jail for quite a while. It doesn't need to be that way necessarily, although we have a good provider now. But I think anytime we have a vacancy and this is a significant one, I think there's going to be some adjustments as to how we deliver services in the mental health area. So it's a time for us to assess it now and figure out how we're going to move ahead. Because it does tie in multiple programs in human services.
Mhm. So we're already starting the work.
Madam Chair, I would just like to add too regarding the mental health issue. Yesterday, we had our annual jail inspection, and part of that process includes he or she, in this case, we have a new jail inspector and it's a he. Doug went through and interviewed quite a few of the inmates, and he commented how obviously we are on top of a lot of the mental health because of the feedback he got. And then he has the comparison dealing with the rest of the jails in northwestern Wisconsin as a comparison. So I thought that was pretty positive and enlightening.
Wonderful. Boy, we're all getting inspection. I just had 3 surveys under my belt in the last 2 weeks. Okay. So any other recommendations, or would you like, I mean, one of the things that I could do, because this just came to me as far as the recommendation to be considering working with families that are impacted. Would you like me to put together a little bit more what that spending would look like and figure out a little bit more about MAT and bring that back next month? Yeah. Okay.
Yes.
Any other questions?
I just want to say that you're doing, I don't have any additions to your budget. I think you've done a fantastic job and you all are doing a very good job.
Thank you.
Thank you guys.
Okay, if there aren't any other questions, we can have Sarah come up and speak to YJ. And she has a PowerPoint that I can share as well. Maybe.
So I can start with our numbers for September. We had a total of 11 new referrals that came in. We were able to handle 2 of those through a current supervision order, which means that we already have the juvenile on our caseload, and instead of creating a new either court order or working informally, we just handle it through their current order. We had 1 temporary physical custody in the month of September. We had 5 recommendations to the DA to file a petition. We had 1 recommendation for informal supervision or a DPA, and we counseled and closed 1 of those as well. In the month of September, we had 7 out-of-home placements for youth justice. We had 1 secure detention hold, and we had 2 active CAPIASs. At this time, I know we have 1 active CAPIAS, so we were able to handle 1 of those. And I know at this time, the total number of out-of-home placements has come down as well. However, of course, we have the juveniles in line, then waiting to go to placement as well. For the month of September, we had a total of 36 open youth justice cases. I am currently, as a supervisor, overseeing 3 of those cases. Shannon Kraus has a total of 15 ongoing cases, and there were 3 pending court cases. Kim Lambert has a total of 13 ongoing cases and 3 pending in court. And Amy Thompson, who was hired to be our foster care kinship coordinator, is also helping out with youth justice because we continue to be quite busy. So she at that time had 4 ongoing, and that she has 1 pending in court. So what I wanted to do is go over what youth justice looks like and what our day-to-day work looks like. I think this might be a repeat for some of you. I know I've gone over this in different law enforcement trainings and at the HHS board meeting. But youth justice is a statewide program to rehabilitate juveniles from the ages of 10 to 16 years old. In the state of Wisconsin, 17-year-olds are charged as adults. The goal of youth justice is to prevent juveniles from entering the adult system through identifying needs and implementing services. When possible, informal supervision should be attempted, which keeps the youth out of the court system. This is called a deferred prosecution agreement, or a DPA. The typical timeframe for a juvenile to be involved with us in our services is typically 6 to 12 months, depending on the seriousness of the referral that we receive. Some of the different strategies that we use are intervention and prevention, building relationships. We use an assessment tool called the YAZI, which helps us identify their risk level. We acknowledge diversity, we identify services, and we provide support not only to the juvenile, but oftentimes to the family and school meetings. We often work to engage and empower parents to help them learn how to implement consequences and also implement rewards. We like to increase community knowledge, and we continue education and training. The youth justice process, this typically looks like law enforcement sending us a referral that is related to a delinquent crime in the community. They come in with their family, ideally. Sometimes we get no-shows, but they come in for a meeting and we sit down, we talk about the incident that brought them to the meeting and whether there's AODA history in the family, if there's truancy concerns, we get just a better feel of everything that's going on in the home. After that meeting, we make a recommendation of we can either counsel and close that referral and give them a warning, We can choose to do the deferred prosecution agreement as an informal supervision, or we can request for the DA to file a delinquent petition in the case. So after we make our recommendation, the DA then has 20 days to make his recommendation, which can be at times in disagreement with what we're recommending, and he might think the case is significant enough to go to court versus the informal. However, he hasn't disagreed with me yet. That's good. What happens on a DPA, the informal supervision? So this is an informal agreement between the family and the juvenile that they're agreeing to work with the department on. They might have to complete community service hours. They may have restitution, therapy, counseling. They have reoccurring meetings with the youth justice worker. This happens 1 to 4 times per month. They may have to do random drug screens. This agreement may also be revoked if they're not in compliance with what we agreed to. And when that happens, we then request a delinquent petition be filed with the DA. So if the case gets sent to court, the DA files the delinquent petition, which gets us in front of the judge. A plea hearing is scheduled. In adult terms, that would be initial appearance. A status hearing or fact finding is then scheduled, which the fact finding in adult terms would be trial. A dispositional hearing is scheduled, so that would be sentencing in adult terms. Our day-to-day work in youth justice is quite consuming at times, depending on the risk level of the juvenile, which I know I've previously mentioned that the kids that we're working with are typically moderate to high risk level, which means they take a lot of our time. It's rare that we see a low to moderate risk kid in our county. So when workers get involved, they have regular meetings with the juvenile. Again, this could be 1 to 4 times per month, and it could be we're meeting for 1 time per week. So once a week for a month, and then after that month, if it's determined the kiddo is doing what they need to do, they're on a better track, we can lessen that time. And we can also, if they fall off track, add more meetings as well. We will often utilize carry guides surrounding areas to be determined an area of concern. Examples are drugs and alcohol, antisocial friend groups, family, anger, and general life skills. The workers may assist with getting therapy and counseling set up. And workers attend school meetings and offer support. So a lot of times what we've found is our families are not, like these kids are in this situation because of the lack of consistency and support from their family. So when we ask families to schedule therapy meetings or AODA, they don't see it as a priority, and we are often having to step in and do some of that parental type role. When we do that, we're able to ask the court, as long as they're under a court order, we can ask the court to give us, the department, legal custody for the duration of the order. That means that we can step in, we can sign needed medical releases, we can get them set up in therapy. Let's see. While we try to empower the parent, like I said, to implement the consequences and rewards, sometimes parents feel, especially when they have a teenage son, that now they're bigger than them and they can't make them do anything. So in circumstances when that happens, our department can often step in and kind of be the disciplinary, for lack of better terms. I have had different cases in the past where I've taken a juvenile's Xbox for the entire summer because the parent couldn't do it. So there are things we can do. We can also implement 72-hour holds, which would be in secure juvenile detention. We can do house arrest on an ankle monitor, or we can add community service hours to whatever agreement they're on. When they are court involved, we can ask for extensions. We can ask for a change in placement. And we can do permanency reviews if they have been taken out of the home. Let's see. What else? 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 Let's see When we do a temporary physical custody, this is also known as a TPC, the day turns very chaotic very quickly. And I think all entities, whether it's the DA's office or the courts, the JAs, everyone's day is chaotic because everyone's rushing to try to get this hearing in, because if we take a juvenile into custody, they have to be in front of the judge within 24 hours. These are obviously unexpected and unplanned occurrences that typically happen after the workday or during the night. Juveniles may be taken into custody and placed in the juvenile detention center or placed at an appropriate unsecure location, which may be a family member's home. The problem we often run into talking about families is these families often don't have the people to say, this family member is an appropriate person for this kiddo to go to, because there is the family trauma, and whether it's people using drugs or alcohol, it's a big struggle in our county to find that appropriateness. I'm going to skip over some of this just because I feel like it's repetitive. So when we do remove youth from the home, this should be when all less restrictive options have been attempted and they were unsuccessful. Kids that go to the detention center, they are typically charged with pretty significant crimes. Disorderly conduct and whatnot is typically not one of them. Truancy, marijuana, it's more so for battery and significant assaults that they would be placed there. Once a youth is removed from their home, the permanency reviews are completed every 6 months. The 6-month review is completed within the agency, and the yearly review is in front of the court. And just going over like how time consuming this kind of thing is when we take a kid out of custody, it greatly increases the worker's workload with having to do all this extra paperwork, the permanency reviews, and getting all the needed information to different placements to consider them, which is their full history, school history, IEP information, day treatment records, social history, legal history, and more. So just giving an idea of kind of what the day-to-day work looks like, as some may be unaware. Any questions?
So what is the recommended caseload per worker?
That's a great question. So when I had worked, can have Bruce roll his eyes. When, sorry, I got distracted. That's weird. So when I've worked in different counties, and then I came to Sawyer County, I had asked myself, like, why is it so much more difficult here managing 15 cases than it was in the other counties that I was in? And the answer to that, it came to me, it's because of the risk level of the kids that we're working with here. And that moderate to high just demands so much more of our attention. And our county has, while taking kids out of their home is not youth justice's goal, like, we don't want that to be the outcome. But the reality here is it's so needed, I think, and overdue, and we're cleaning up some of what hasn't been done for a while. So to answer your question, I'd say 15 where the workers are right now would be max for the kind of work we're doing here. I would say in a different county, you could probably do 15 to 18 successfully. Anything else?
No, thank you. Okay, any updates on community services?
No, still sitting pretty good there. Timber Bay did hire or has someone appointed to be a regional guy for that area. He's just now getting started, so and their goal is to get their hands on the worst of the worst kids in the neighborhood and hopefully put their neighbors House of Hope out of business by getting them on the right path and stuff like that beforehand. Other than that, I think there's a bed or two open at House of Hope currently. And things are just kind of still plugging away in the right direction for the community stuff. Short and sweet.
Okay. Any questions for Grant? Okay, moving on to board appointed committee updates. Okay, seeing none. Any correspondence, reports, or conferences updates? Okay, and then I think we'll call this meeting adjourned. Thank you.